I am Dr. Salil Mahajan. I am working as consultant in Department of Neurosurgery in Metro Hospital, Haridwar. So today my topic with you all guys is epilepsy surgery. So when do we go for epilepsy surgery? Epilepsy surgery is a treatment to treat epilepsy in all the patients who are taking more than one anti-epileptic for a long period of time. So when at least two anti-seizure medications who have failed to control your seizures, so epilepsy surgery are considered as a treatment of choice for such patients. So I will tell you who all are the patients who are eligible for epilepsy surgery. So I see very general children, young adults, male patients, young ladies. So all those patients who have been on anti-epileptic for a long period of time, more than one, and they medications are gradually increasing in frequency, and but their seizure frequency is increasing gradually and gradually. So for those patients, we consider epilepsy surgery. So there are prerequisites that must be fulfilled before undertaking those patients for these type of surgeries. Like the epileptic focus should be localized. We should be able to localize the epileptic foci. It should not be a generalized seizure having a generalized outcome. And the area of the brain in which the seizure is originating, we should be localized to it. So there are we have investigations to diagnose these conditions like MRI brain contrast with contrast. It generally picks up the focus of epilepsy in these patients. So in case the epileptic origin is not being picked on the MRI, we have the electroencephalography. Generally, electroencephalography picks up the seizure in 10 to 20% of the patients, but we can make it more specific by doing a videographic EEG. In videographic EEG, we admit the patient for 24 hours. We observe the patient, and during the time when the child or the patient is having seizure, we do at that time an EEG. So that is a very good investigation. Okay. Then another investigation, which is the advanced version like SPECT, which is a modified version of positron emission tomography, and also we have SPECT, which is single photon emission tomography. There are other tests like WADA test and brain mapping, by which we can localize the hemisphere on which the seizure foci is originating. So, what is the treatment and what do we do in these type of surgeries? What surgeries? First are resective surgery. We admit the patient and we do a craniotomy, which is a uh, stereotactic guided, and we excise the focus under our microscopic vision. And another modality which we can use is laser therapy, laser interstitial thermotherapy, which is also a type of ablative surgery. So if we go to advanced things like brainstem stimulation, that can also be used to resect the epileptic foci. There are some children which have epileptic hormones or epileptic syndromes associated. So these children are very vulnerable because they are most of the time I've seen they are on multiple anti-epileptics, not one, not two, more than four or five. So in those children, we try a process which is known as corpus callosotomy. There is a corpus callosum which connects the two hemispheres of brain. So we can resect it, and that surgery is also very effective. What we can do is hemispherectomy also in these patients, like a complete hemisphere, which is non-dominant in these patients, like uh, left hemisphere is dominant in 80 to 90% of the patient. So in those patients, we can excise the complete hemisphere and disconnect it. Okay. The purpose of surgery. The purpose of surgery is to make the patient fit free. If we can achieve this target within 2 years of surgery, that is the success of surgery. This is one success of surgery. Another success of surgery is reducing the frequency of seizure in these patients. Like a patient getting 20 to 25 times seizure in a day, if that frequency is decreased to even 1 time a day, that is also success of a surgery. And also another success of surgery, reducing the number of anti-epileptic drugs. If we are able to reduce anti-epileptic drugs from 4 to even 1, and over a time, if we are able to taper and make the patient free of any anti-epileptic drug, that is also success of surgery. So these are all benefits of surgery, and according to studies, 70% of the patient who have gone anti-epileptic surgery, they have become seizure free. Yes, that is a great hope for those patients, and thank you all.